Well, good morning, everyone. I am State Representative Brian Patrick Kennedy. I am the Speaker Pro Tem of the Rhode Island House of Representatives, and I was just elected President of NCSL. And in a couple of hours, I'll actually get the ceremonial gavel handed to me just before everyone gets to see Peyton Manning. This morning, we're going to do a session regarding Kratom and the Kratom Consumer Protection Act. And since I mentioned I'm from Rhode Island, I can tell you that Rhode Island is one of just a handful of banned states. When the FDA went and sent out advisories to the different states advising them that they would like to see Kratom banned, unfortunately for the people of Rhode Island, our health department decided to take that step, and the language of the ban in Rhode Island mirrors almost word for word what the FDA proposed. In Rhode Island, I am in the process of having legislation redrafted to submit again next year to both the House, and we have a Senate sponsor as well. This year, we passed the Kratom Consumer Protection Act through the House, and unfortunately, the Senate sent it to the wrong committee, and it did not ultimately move forward, much to our disappointment. As I mentioned, there is just a handful of states that are banned states. Most of the states do allow for the use of Kratom legally, and our purpose in promoting the Kratom Consumer Protection Act is to make sure that it's not only legal, but it's safe and unadulterated. We think there's a lot of uses for Kratom, and we hope to move forward with getting that adopted. We actually had meetings here in Indianapolis at NCSL already to talk about this. This morning, I actually have the great pleasure of introducing our keynote speaker, Jim Carroll. Jim is the former drug czar in our nation's capital, and he has been a vocal supporter of Kratom. So without further ado, because I want to allow for time for questions, I'd like to introduce Jim Carroll.
Thank you, Mr. President. It has a different connotation in D.C. and
Hey, President Kennedy sounds good no matter where you are.
Absolutely. President Kennedy wanted me to first off recognize that we have representatives here from the great state of Hawaii, and to show our support and affection and love for Hawaii for the tragedy they're going through for the wildfires. The conference next year is being moved to Maui. Is that potential? It's under consideration. In all seriousness, we do wish you well, and Representative Mizuno has said, please come visit Hawaii. Please come back and rebuild the economy, help the people there that are suffering, and that would be one way to do it. If it's okay, I'd like this to be more of a conversation, and so I'm not going to use the podium. I'm going to sit down. You can see why I'm going to sit down. I'm going to sit down and have this be more of a, even though it's August and it's kind of hot, let's have a fireside conversation and just sort of talk about some of the issues that our country's facing. Can you still hear me? Is this okay? So first off, if I were you, I'd be asking, what is the U.S. drug czar? What does that mean? What does that person do? And I was very honored to be in that position. And much like President Kennedy, this is not, being the president, being the U.S. drug czar is not a truly political position. I was unanimously confirmed by the U.S. Senate, as was my predecessor, and as was my successor, Dr. Gupta, because it really is viewed as the person who should not be political. It's the person who should priority be thinking and caring about the people that are suffering from addiction. It's thinking about making sure that our children are properly educated on the issues that they're facing of drug addiction, of these drugs that are out there on the street, and they don't really understand the dangers. And it's also overseeing the law enforcement aspects of the illegal drugs that are coming into our country. So with a staff of about 100 people at the White House, I oversaw the $35 billion that the federal government spends on those three issues of prevention, treatment leading to hopefully long-term recovery, and then as well as the federal law enforcement on keeping the drugs out of our country. I got into that despite being a lawyer, and I think that I want to say that at the beginning, that I'm a lawyer, I'm with the federal government, I'm here to help. And yeah, I agree, right? No one wants to hear that. And I think that's the reality of what is happening in the federal government. And this, again, is not a political issue. The issue that we're talking about really is saving lives, and I think that's the bottom line issue. Right now, we're losing 109,000 Americans per year to either an overdose or a poisoning, because some of these poisonings are from truly children who don't understand what they're doing. They don't understand the dangers of what they're taking. Either they're buying off someone on the internet, on social media, from their phone, or someone else. And sometimes they just really have no clue what they're doing, and they're truly being poisoned. 109,000. We're talking about someone dying every 5 minutes. And there's a lot of good work that is being done, but sadly, the numbers continue to rise. And so what do we do? This is impacting not just Rhode Island and not just Hawaii, but it's every community, every demographic. It also includes my family. My daughter became addicted, became dependent on opioids. It started with prescription. That's how my life changed, and I refocused my efforts to work on this space. I'm incredibly blessed. My daughter's incredibly blessed. We were able to get her good treatment, effective treatment, and she is in recovery. And I know it's hard to believe, but I'm actually a grandfather now. She got married, and I know you were like, how many times over, Jim? It's just one other time. But the reality is that not everyone has such a happy ending, and I know I'm incredibly blessed. So what do we do? How do we help the estimated 15 to 20 million people in this country that suffer from an addiction? We know we need good treatment. And I have to say, and you all probably see this in some of your communities, you might hear that saying, how many beds do you have available for treatment? That's really I hate that question. I hate that because it's not beds. When we talk about 109,000, it depersonalizes what's happening. When we talk about how many beds are available, we're depersonalizing what is happening. So we need to think of this as individuals, as your own children, as your own loved ones, family, neighbors, coworkers, colleagues. And that's the approach that I think that we need to take when we're talking about criminalizing behavior, and we're talking about making sure that we're not just doing beds, we're actually getting effective treatment. So let's talk about the science of treatment. Treatment is a very subjective skill. Sitting down with a counselor, most of the times, for a lot of these people, you're sitting down with a peer, with someone who is in recovery, because they understand. We know the gold standard for getting someone into long-term recovery, and that's what happened with my daughter, is MAT, medication-assisted treatment. And typically that's when people think of buprenorphine, Suboxone, a drug that is an opioid that helps wean people off from their really often fatal disease of addiction. But there is something else that's out there that is not an opioid, that is not a controlled substance. And this is where we go back to the science. The National Institute for Drug Abuse is part of U.S. Health and Human Services, NIDA, and it's run by Dr. Nora Volkow. Dr. Volkow serves at the pleasure of the President of the United States, serves at the pleasure of President Biden. She's been there in that role for the last 4, if not 5 presidents. She's recognized as one of Time's 100 most influential women. She's recognized around the world and has gotten awards around the world for her work on drug addiction. So I'm a lawyer, I'm not a scientist. I'm used to representing clients, at least back in the old days, and representing people who needed to stand in front of a court and have someone judge them. I feel my role now is a different type of representation. I feel incredible pressure, but incredibly fortunate to be able to, in some way, try to represent the individuals who are suffering from addiction and to help the families like mine who are trying to work with their loved ones. It seems that every week, including this week, yesterday, I spoke to someone who lost their son to an opioid overdose, an opioid poisoning. So how do we help these people? Let's go back to the science. Let's go back to what Dr. Volkoff said. She testified in front of Congress, which I've done several times. It's not always fun. A lot of politicians here, a lot of legislators, you understand. Being on the other side of questions, you all like that, right? You like making people squirm sometimes. Under oath, Dr. Volkoff has testified that Kratom, the science and the facts show that this could be a safe alternative to the opioids in Suboxone and buprenorphine. Other component within HHS that is important is the Assistant Secretary for Health. That position, again, it's sort of like a position like the U.S. Drug Czar. You're like, okay, well, how many assistant secretaries are there at HHS? There is one for policy. There is one that oversees the U.S. Surgeon General, and that's the Assistant Secretary for Health. Really the most influential policymaker at HHS. When I was U.S. Drug Czar, the Assistant Secretary for Health was Dr. Brett Joie from Louisiana. I don't see anyone from Louisiana here. I promise we're not going to go to New Orleans. Uh-oh.
Just change the slide.
Okay. It was much better looking to have you than me up there. I want to make sure. We're not going to go to New Orleans, John. I promise we're going to stick with Hawaii next year. But Dr. Joie has written publicly about Kratom, saying that were Kratom to be cut off, we're putting millions of people at risk who are using Kratom to help with their withdrawal from opioids. And with 15 to 20 million people suffering from addiction, do we really want to be in a position of criminalizing that behavior, institutionalizing people for that behavior, but quite frankly, as far as I'm concerned, even more importantly, cutting off a life support for them? In your communities, hopefully naloxone, Narcan is more widely available. Hopefully for opioid issues, I carry naloxone. The one I carry is an injectable that is 5 milligrams, a little bit stronger than the 4 milligrams nasal, because sadly the drugs that are out there are so lethal. This is a tool to save lives, and it's wonderful. And if you have any questions or concerns about getting naloxone, I'm happy to help it and get some donated to your communities, wall-mounted naloxone, whatever you need, I'm happy to do it to support you. This saves the life on the spot. But what do we do after we save a life? How do we get them into safe and effective treatment? How do we make sure the treatment that they're getting is good treatment? And that's one of the things that we want to work on, is making sure that consumers are protected. So the KCPA, the Kratom Consumer Protection Act, which President Kennedy, I just like saying that, I hope you don't mind, that President Kennedy has talked about getting in Rhode Island is just that. It's protecting consumers. The American Kratom Association is not asking for Kratom to be completely legalized and available anywhere and sold any way whatsoever. It's actually one of the few entities that is going to the federal government to saying, please regulate the industry, please help us. What the Kratom Consumer Protection Act is doing is making sure that the Kratom that is sold is regulated, that it is marked, that there is the ingredients listed to make sure that it's not adulterated. You might have heard in some of your communities about deaths from Kratom. From the HHS studies, every single one of the deaths associated with Kratom, the people had polydrug use. There were other substances in their system. Sadly, we know that That's what happens. We were talking earlier about people taking a pill. They think they're taking an Oxycontin. They're thinking they're a kid at a party taking something that's going to help at a party or help them get their exams, and they're taking something but they don't know what it contains. That's what we're trying to prevent with the Kratom Consumer Protection Act, that it's properly labeled, it's properly regulated, and that consumers know the quantity, if you will, sort of the dosage that's in there. If you go to a vitamin store, if you go to GNC, there's got to be good vitamin stores in Hawaii, right? Okay, we said yes. So when we go next year to Hawaii, and you go to the vitamin store, you can see the dosage, you can see what you're taking. That's exactly what we want to happen now with Kratom. So you're asking, what about the FDA? And President Kennedy, the leader of the free world of Rhode Island and NCLS, has talked about what do we do with this? What do we do to make sure that people understand? And so the Kratom Consumer Protection Act truly does protect consumers so they know what's out there. So with that, I really want to open this up for questions. I'm happy to talk either about Kratom, obviously. I'm happy to talk about drug policy, about what's happening in our country, and how we don't criminalize people who are using something to help them. I think we sort of realized, as I did back as a prosecutor and back in the early 90s, were you born in the early 90s?
Oh, yes. I've been in office for 35 years, so.
Okay. Or just, sort of talk about that, back then as a prosecutor, you thought, okay, well, the most effective treatment, and truly I believe this, I admit this, you can beat me up later, but this was the prevailing thought, is all we have to do is incarcerate them. That's drug treatment. That's keeping them away from drugs. Boy, is that wrong. And so we know that doesn't work. That's not treatment.
Well, and Jim, I would note, so many of our states have already passed recreational cannabis use. Now, the interesting thing is cannabis is banned at the federal level, but it's the states that are going through the process of making it legal, even though for banking purposes, you still cannot use those particular networks in order to, so that's why pretty much anybody who's purchasing cannabis, it's a cash deal for the most part. I guess you can say the reverse to that whole thing is the fact that 5 states, including Rhode Island, currently ban Kratom, and yet Kratom is legal at the federal level. It has never been banned. So 45 states allow the use of Kratom. And as Jim said, we're looking to make sure it's a pure product, an unadulterated product, a product that an individual can feel confident with strict labeling requirements to show exactly what you're purchasing, the dosage, the recommended amount, the strength, so that there is not going to be any issues whatsoever for that individual. They're going to know exactly what they have. As Jim noted, we've already seen articles that have occurred, and a couple of weeks ago, it actually showed up even in, there's a person by the name of Kim Commando. Kim has a program that she runs on television, on radio, to talk about the latest things in computers and technology. But what was her lead story? It was about Kratom. What does that have to do with technology or anything else like that? The fact of the matter is, she was pointing out some of these deaths that had occurred, but the reality, in just about every case, there is some other drug that was laced in there. And we have seen a big problem, particularly with fentanyl. China is pumping that into the United States because it is so cheap to make, and so far we have not been able to stop that. But one of the things I would like to point out, so I had the good fortune to actually go to Indonesia and travel to the rainforest to see Kratom being grown, Kratom being picked, Kratom being dried, Kratom being made into the powder that ultimately will be used to be shipped here to the United States. However, there's also an interesting domestic source for Kratom, and that is Hawaii. it is grown there. It has, for all intents and purposes, they're able to grow it in the different color leaves. They're able to process it, and it has the same types of effect as kratom that's grown in Indonesia and soon in Thailand, where they're looking to also become a leader in the production of kratom. So with those things in mind, the one good thing for the kratom that's grown in Hawaii, the FDA can't do anything about that. It's a domestically produced farm type product, and that's a wonderful thing. Just a few weeks ago, I had the opportunity to travel with some of my colleagues to Indonesia, and we actually met with the farmers. We met with the Minister of Health. We met with their trade folks, and we're feeling much more upbeat that we're going to make some major progress on this because we recognize the benefit of kratom, particularly because it has been shown time and time again how great this has been as a means to help those people who have an opioid addiction to get off of opioids.
The first off, all the representatives here, be careful. Your staff is going to write a kiss and tell book, and maybe my kiss and tell book from the White House days would be talking about FDA. I'm not sure how many people would buy the book just to talk about FDA, but I'll give you my off the record kiss and tell story from the White House on kratom and the FDA. So when I was the U.S. Drug Czar, FDA came over and said, "Need to have a quick meeting. Need to tell you what's going on." And I really wasn't familiar at that point with kratom. I'd heard about it, knew the name, knew generally what it was, but I wasn't that familiar. And they came over and said, we need to do a controlled one substance, ban kratom. And my scientists, my researchers were with me and asking questions back and forth. And it seemed like a, sort of a fait accompli, like this is done, this has to happen right now. What they left off were the stories from the actual researchers, from Dr. Volkoff and Dr. Jawah, saying you're going to harm millions of people, that the studies have shown, including Johns Hopkins University, which I'm sorry isn't in Rhode Island or Hawaii, but not a paid study, by anyone, but Johns Hopkins saying that 87% of people who used kratom, it helped them get off opioids. All that was left off. And the Brett Jawah found out. They just called me, sort of panically pulled me out of a meeting and said, "What's happening?" I told them what's going on and said their next stop was going to the DEA administrator, Udom Dillon. And Udom was the last one to sign off, and one of the 3 signatures required. And the Udom Dillon was pulled out of the airport at Reagan Airport because they called me and saying, why am I being, pulled off my flight to take a phone call? And it's like, because you just got a briefing on FDA and it's not accurate. And so there was a call with Brett Jawah, the Assistant Secretary for Health, and we were able to prevent the FDA from doing this. People have asked, someone asked me this morning, why is the FDA doing this? I really don't know. I wish I had a really good answer for you, but I think we can go back to 1994. And we talked about 1994. You were serving even in 1994.
I was.
Hard to believe. You look pretty darn good.
It's like that radio station. I give you the best of the 80s, 90, 2K, and today. Back in 1994, the FDA tried to do this with dietary supplements. And they were trying to ban them, control them. And they lost on that because they didn't have the science and facts behind them. The last thing I'll say, and then I really do want to open up for a few questions if you have them. The DSM, the Diagnostic Statistical Manual, does list addictive drugs. And that's one of the things that you hear about. Oh, kratom's addictive. Well, let's talk about what the DSM says is addictive. And they list the following substances. Marijuana, it's addictive. Hallucinogenics, mushroom, things like that, addictive. Opioids, absolutely, we know it. Alcohol, not surprising, we know that. We know a lot of people suffer from the disease of alcoholism. Caffeine, the cup of coffee I had this morning. And like some of you, a lot of you want your cup of coffee in the morning to get rolling. And tobacco. Kratom's not listed. And so
while some studies have said it is as addictive as a cup of coffee in the morning, it's not criminally causing criminal behavior like this. So thank you, President Kennedy. Thank you for a great conference. Any comments on moving it to Hawaii next year? Do you want to make any public statements?
I think we have locked in Louisville, but we're going to have to look at Hawaii for a future meeting.
Okay.
But I did want to open
Yeah.
it up to see if anybody, yes.
Right.
Very much interested in learning more, and I'm assuming that you're going to direct me to the KCPA
Yes.
to get information.
Yeah, and there's a
but-
couple of folks from KCPA back there
Okay.
that are happy to do that. And since I live in the DC area, we're happy to pop over and visit you in your office.
Yes, I would very much appreciate that because I'd like to learn more. And like I said, prior to the conference, I had never even heard of Kratom.
Right.
So I'm very interested in learning more. And I definitely also want to get some of the naloxone that you said you all can provide.
Okay, sure.
So,
I'll
okay.
have my card. Let me know. What part of Maryland?
I'm a delegate in Southern Maryland, Prince George's County, District 26. I have National Harbor, Oxon Hill, Fort
Right
Washington.
across the river in
Clinton,
Alexandria.
and- okay, literally right across the
Yeah,
river.
I am
Okay.
right there.
Thank you.
Thanks for being here. And
Sure.
I, in Montana, was able to stop putting Kratom on Schedule 1. I was kind of disrespected by the newspaper. I've used Kratom.
Fake news. I
And,
think that's the term they use in DC. Fake
Oh,
news.
yeah. Well, they said that I was worried that I wouldn't be able to give it to my kids if we passed this bill. And I don't give it to my kids, but I would if they needed it. I haven't used it for addiction, but it's a sleep aid. It's a legitimate herbal medicine. I practice herbal medicine. It's been in existence and used for thousands of years. And I would suggest that this move, I believe, was started in a lot of Republican states. I don't know if Democrat states too, but a lot of Republican states that attempted to ban it and put it on Schedule 1. Goes back to what you were saying about dietary supplements. And as a person who uses herbal medicine, a lot of herbal medicines that work have been attempted to be banned in the EU and the United States because pharmaceutical companies want to be able to patent a synthetic
Exactly.
form. And so I actually don't really like the idea of regulating it at all, because what you're doing now is you're creating a monopoly. And so I'm not sure I can support
Right.
your act, but maybe you can try to convince me not today. I'd like that.
I think the idea, and we can talk afterwards, is really just making sure that people know what's on it. So just with with other supplements, they know exactly what's in it. But we can talk afterwards.
So I think the reality here is when we're looking to pass the Kratom Consumer Protection Act, we're looking to make this herb, this product
leaf.
that's
Yeah,
grown,
it's a tea leaf.
for all intents and purposes, to make sure it is a pure product. You are absolutely right. The drug manufacturers have created a synthetic version. They are pushing to ban Kratom because they recognize that rather than taking a pure, natural, herbal product, they can make a boatload of money. This will be their next great thing that they offer, but it will be a synthetic version, and it will definitely not be as good as the pure product you get today.
Thank you, guys. I'm a state rep from Louisville, Kentucky, so hopefully see you guys next year.
Absolutely.
And then Hawaii.
I spend more time in Kentucky than probably any other state in the country. I know, and so
Yeah.
it's a great state.
If you had to put a label on me, I've been in the legislature for quite a while. It would be a tough on crime Republican. But it just amazes me how that we have so many incarcerated for drugs, and then they have the record that follows them the rest of their life. And then there's such a movement in Kentucky for expungement, that whole train of. But it amazes me how that they would want to so quickly put Kratom as a Schedule 1, and that would be like a felony if they were caught, just like if they were caught for heroin. And a few years ago that was tried in Kentucky, and I was like, we don't need any more criminals. Let's look at this thing and discuss it before we go there. And it was successfully stopped. Because, I think Indiana and Tennessee and many border states to Kentucky, it's a Schedule 1 if I'm not if I'm not mistaken. Not Tennessee. But here's my question.
Yeah.
Can you explain some more of that consumer protection? And we had one here that said no regulation at all, and I believe you guys are promoting the act. And can you explain it a little bit more? Where would you find that?
Yeah.
Thank you. Yeah, my name is Matt Caddo, a senior fellow in public policy of the American Kratom Association. We're out of time, but I'll briefly tell you what the KCPA does. Passed in 11 states so far. And by the way, it's designed to protect consumers against adulterated products. It would say that if you want to sell Kratom in your state, it has to meet GMP standards, good manufacturing standards, that the FDA produces for herbal products. It must be labeled. You cannot synthetically enhance the alkaloids of the plant itself. You cannot add a dangerous substance to it. And you have to restrict it to minors and give serving size directions to safely use the product. That's the key to it. Minimal regulation, but it protects consumers. In Utah, the first state to pass it, actually the Agriculture Department just released a report saying it's cleaned up all of the adulterated Kratom products in the marketplace. It is protecting consumers. The only thing they found was that there was one Kratom product that didn't have a Kratom in it. Well, that's just false advertising. It's fraud, right? But the manufacturers that responsibly register to sell their products sell safe products. And that's the key to it, properly labeled. And we'd love to talk to you, Montana. Yeah. Thank you for beating back the ban, by the way.
Yeah.
Can you give us an idea of what the cost is now for for Kratom versus a pharmaceutical synthetic version?
Great question. A gram of Kratom, the average person takes 4 to 6 grams of Kratom a day, a little higher level for mood suppression, elevation rather, and even higher, but it's about 18 cents per gram for a Kratom product, average. A pharmaceutical product is hundreds of dollars.
Right.
That's the name of the game.
Buprenorphine, the drug that we were talking about, is the same, the synthetic drug that uses people, help people. I will say for Kentucky, I'm a tough on crime person also. Addiction is not a crime. Criminal behavior is a crime, but addiction in and of itself is a disease. My business partner is Russell Coleman, soon to be, I think, your next Attorney General, and I was at his fundraiser not too long ago. And so Kentucky's one of the reasons I spent so much time there. And so obviously, we're not trying, this is not a soft on crime issue. This is a medical issue. And this is trying to help people, and not criminalize addiction in and of itself. But you're going to have a new Attorney General and a new governor.
So we have to bring this to a conclusion, but I want to thank everyone that has joined us this morning, both the legislators and those who are looking for more information about it. Jim is going to be here, so if you want to get his contact information. Mac is here also. Again, he's a senior fellow with the American Kratom Association. And we want to see the Kratom Consumer Protection Act get through in all those states. We want to see this legal because this will help your constituents. So with that, thank you very much, everyone.
Thank you, Mr. President. I hope you don't mind me teasing you throughout the whole thing.
No.
Oh, yeah, he's going to crush, isn't he? What do you think's going to happen with the governor?